Dear friends, welcome back. We continue with our study of applying or using homeopathy for the benefit of elders. Elderly care requires a lot of compassion. At the same time, we require gentle treatment, no harsh treatment. And our aim is to improve the quality of life, bring joy into the lives of people who are quite lonely and who are suffering in silence. The best way to study any methodology is to understand it through case studies. Let's take a look at some. Dr. P Banerjee runs a clinic in Calcutta. In fact, they are fourth generation homeopaths. So as a family, they have got considerable knowledge, wisdom, and data. They have recorded all the cases very meticulously for more than 100 years. And they're very open about sharing that information. In fact, they conduct courses for interns. It's a 2-year course. They have also published a number of monograms, presented papers in international conferences, and of course their website also presents some cases. This is a case from Dr. Banerjee's clinic. This is a male who was 75 years old. He was suffering for 2 months with difficulty in swallowing food, heartburn, and belching. He came for treatment to the Banerjee clinic on 16th of December 1996. He was run through all the battery of tests, endoscopy, biopsy, and other such things. And what they found was the biopsy section shows moderately differentiated squamous cells carcinoma. That means it was cancer. An X-ray, which is shown on the left-hand side with a barium swallow, and it's dated 17th October 1996. It shows that at the GE junction, gastroesophageal junction, at 40 centimeters, at 18 centimeters is a growth extending up to 22 centimeters, causing luminal narrowing. That means it has growth which has narrowed the passage of the food pipe. Almost a year later, in 1997, I should say 7 or 8 months later, they found through the X-ray, which I shall now show, there's considerable improvement in the patency of the esophagus. So if you compare the two X-rays, the one in the top left-hand corner and the one below that, you will find that there is considerable improvement in the luminal diameter of the esophagus. This patient had a 2-month follow-up, during which time he was taking the remedy Candirango 30C potency, 2 drops twice daily. Patient symptoms were gone within 2 months. Very remarkable indeed. Otherwise, there were very few choices, especially for a 75-year-old man. And mind you, most people who come to Dr. P Banerjee's clinic are from the lower strata of society. They are poor, they don't have money, and they cannot afford expensive cancer treatment, which can run into years with no results and very poor quality of life. In fact, it's tremendous suffering for the families as well as for the individual, both financially and psychologically. Here is another publication which you can find on the website of Dr. Banerjee. This is the 3-year survival rate of lung cancer for treatment given by Dr. Banerjee. This is a comparative study and there are different authors or researchers and it compares their results. So Pass and other scientists who published a paper had a 46% survival rate. Roth and others had a survival rate of 56%, DePierre 52%, and Dr. Banerjee's protocol At the end of this presentation, I'll just present some X-rays which were for bone cancer or osteosarcoma, and the pictures tell more than what words can describe. These are three X-rays. The first one is dated 5th June 2003, and as you can see, the circle in red shows where the osteosarcoma is. 6 months later, 16 December 2003, once again if you see, there's tremendous improvement, and a year later the bone is perfectly well formed. There's absolutely no sign of any disease. Beautiful recovery in just 1 year. Normally these cases would require amputation of the limb, with its obvious consequences on the quality of life, survival, social contact, and suffering for the family, which never appears in normal statistics. So friends, thank you very much. I'm sure you look forward to using homeopathy in the care for elderly and integrating it with your practice, no matter which school of medical practice you follow. Don't forget, homeopathy is your friend. It is not in competition with anything. We are here to serve people to enjoy and fulfill the purpose of their lives. So thank you very much, and bye-bye.